Federal workforce are affecting military veterans. CNN has obtained an internal memo from the Chief of Staff of Veterans Affairs detailing plans to fire tens of thousands of VA employees. More than 70,000 workers could be impacted, and the whiplash caused by Department of Government Efficiency chaos has already cost more than 1,000 VA workers their jobs, and many of them are veterans. 30% of the federal workforce has served in the military, and a majority of veterans said that they were voting for Donald Trump in the 2024 election. In my column out today at cnn.com/homefront, I speak with a veteran in Kansas, fired from the Department of Agriculture, who voted for President Trump. And he describes terminations that have upended the lives of many employees in his agency as a sudden drawdown, poorly executed. He told me, quote, "I'm sorry to put it like this. It was like the pullout of Afghanistan." Dr. David Shulkin is with us now. He is the former Veterans Affairs Secretary under President Trump in his first term. And talking, David, with this memo that we now have access to about returning staffing to 2019 levels, up to 70,000 positions terminated. When you look at that, can you do that at the Veterans Affairs Department without impacting veteran health care and benefits?
Brianna, it's pretty concerning how you can do that. You know, if there's one thing that I know Americans are unified on, it's the desire to get veterans the benefits and services that they've earned and in their sacrifice for this country. And I do applaud the administration for taking a look at how they can make this agency work better. We cannot continue the status quo. The wait times are going up. There are 935,000 claims in backlog for benefits. Their veteran suicide is actually on the rise. We have tens of thousands of homeless veterans. So we do need to take a look at how to improve this system. But I don't know any system that slashes its way to excellence. And what we haven't seen, while we've heard about all of the contracts being canceled, we've heard about employees that are going to be laid off, what we haven't really heard are the plans to make this system better. And if you reduce the number of employees at the same time that we've recently added 400,000 new veterans to the VA system in the past 12 months, and we've given all these expansion of benefits, and you slash the number of employees, I don't see how you're going to get to a better outcome unless you're investing in technologies to help the staff do a better job, unless you're opening up this system to the community care approach. And so we just haven't heard about any of those plans.
Yeah, millions more veterans now eligible for benefits and services since President Biden signed that toxic exposure bill, the PACT Act, which had so much broad support. We're hearing Secretary Collins, the VA secretary, insisting that these DOJ recommended changes, at least recommended, won't affect care for veterans. But, you know, there are already reports of overburdened benefits staff that have been canned in these early firings. I'm hearing worry among VA employees that mental health professionals are among those who have been cut so far. That's not even among these 70,000 that we're talking about what they're planning for. I even heard from one veteran who has voluntarily stopped getting their mental health care because they have a fear that DOJ may access their records, because we know that DOJ has been going into systems in different agencies. What does that kind of thing mean for the services the VA provides veterans?
Well, look, the VA is a terrific national resource, and it's filled with people that are there to help veterans. So the one thing we don't want to do is lose the confidence in the VA. There are people trying to do a great job, but morale is very low right now. And when you're slashing the workforce and you're not giving a plan as an alternative to be able to help modernize the VA, to be able to relook at these access standards so that veterans aren't waiting for care, then that's where you begin to start losing that confidence. And, you know, we've worked really hard to make the VA a better place. And I know that Secretary Collins wants to continue that and wants to strengthen this, but you can't cancel the amount of contracts that have been done. You can't fire 70 to 80,000 people who work in the healthcare system and still meet all the needs of the veterans who need this care and who need these benefits, unless you come alongside with it a plan to really invest in the technology and make sure that this system is working for the veterans. And we just haven't heard that piece of it yet.
You mentioned contracts that have been cut. Collins initially defended planned contract cuts as consulting deals that the VA could do without to save money. He minimized what those planned cuts were. But then a week ago, the VA actually took a pause on those proposed cuts, some of those cuts, after there were concerns it would have a negative effect on healthcare services for veterans. Does he need to be more forthcoming when it comes to describing what is happening here to make sure that he retains the faith of veterans?
I think that the secretary is trying to be forthcoming. I think that he's communicating a great deal, but I think that it is very hard to understand what the consequences are of canceling these contracts when you're doing this as fast as they're doing it. So it may sound like it's a good idea to cancel a contract, but unless you really understand what those services are and what the second degree consequences of those decisions are, you end up at big risk of impacting the services that are being delivered to the veterans, because so much of the care right now is a combination between the private sector through these contracts helping the VA deliver on the obligation that we have to our veterans. So it is a concern how quickly we're moving and the lack of understanding of what some of these decisions may bring.
Dr. David Shulkin, former Secretary of the VA, thank you so much for being with us.
Glad to be here.
And we'll be right back.